today, as I'm going to be talking about substance use disorder, I think we are also, as you mentioned, that we've got quite a great discussions, and I think even today, linking all three topics from gender-based to substance use disorder, as well as mental health. And I think, you know, as myself, as I said, from the South African National Council of Alcohol Drug Dependency, there will be topics that I'll be covering today, and I'm here with my other colleague from another branch of ours in the Free State, Ms. Mariki, who will be actually then focusing a lot on codependency as well. So we'll be linking most of our presentations together. Just to give a bit of brief introduction of actually who we are as SANCA National, one of the most largest substance use disorder company in the country, that we all have over about 30 treatment centers and 74 service points, all in our 9 provinces in the country. We have established an infrastructure and extensive network that ensures good quality and coordinated service delivery supported by trained and experienced multidisciplinary team that consists of doctors, nurses, psychologists, psychiatrists, as well as social workers, as well as addiction counselors, and that actually form a holistic approach when we are treating substance use disorder. You will also get to see that some of my presentation, as I'm going to be doing today, is that we are breaking the stigma of always saying substance abuse. Since it has been classified under DSM-5, which now makes it as a chronic ill disease, as a brain disease, because this is a disease that we're saying that it's not actually curable, but treatable. And that is the most important thing, that we need to start to familiarize ourselves with the terminology when we are actually talking about substance use disorder. So as SANCA, we do a various kind of programs, and these are the programs that we offer: holistic medical and non-medical treatment approaches into substance use disorder. We have ongoing treatment and prevention awareness programs where we do exhibitions, where we do awareness campaigns as well. We've got program design and development, because each and every time with substance use disorder, we do realize that now and then, you know, there's new drugs that are coming up, you know, people are becoming creative in terms of using substances, and there's a lot of concoctions that have actually taken place, especially during the pandemic. We've seen a lot of those. We also do advise and contribute to policy issues from schools, especially, and as well as employers, in terms of companies, whereby we assist you in terms of drafting a drug policy in the workplace, so that you know exactly how you can be able to assist your employees and your staff members when it comes to SUD. We also do develop and maintain clinical guidelines and protocols to make sure that all our treatment facilities, as much as they are affiliated with SANCA National, they all work independently. So therefore, we do offer them their support, the training and capacity building. We also do community development. There's also a part of research, just to always make sure that, you know, we align ourselves, you know, with the framework that globally that is also used. We have a lot and intense stakeholders around the globe, around the country, as well as international, where we get to engage, where we get to share information, where we get to see what works in other countries, how can we incorporate it in some of our country, in our country as well. Stakeholder relations and partnership, very quite critical for us, quite important, so that we are always able, you know, to engage and share expertise. You know, I might be an expert in SUD, somebody might be an expert, you know, in GBV or mental health, you know, and so forth. So it's very quite important that we keep that relation going. Monitoring and evaluation, quite critical, quite important, extensive for us, to make sure that, you know, all our SANCA branches, there is a standardized kind of treatment programs that they follow, that they actually get to do, and to also make sure that, you know, what they are complying in terms of the standard of our country as well, so that, you know, most of our patients and clientele that we actually have in some of our treatment centers, they're actually catered for and taken good care of, and to make sure that the program that we say we are offering, it is exactly that we are offering. Just to give you a highlight in terms of what we had to actually just overcome during the pandemic. It's been quite a very challenging year for most of us, and as SANCA, we had to really adjust ourselves, you know, pull up our socks where we can, learn new ways of doing things, especially in terms of offering services to our communities, as we do understand that some of our communities, you know, when it comes to technology or when it comes, you know, just to resources, there's a bit of challenges in there. So what we've seen throughout the pandemic, since starting the lockdown last year in March, is that through our WhatsApp line and also our phone calls, we've had an influx of phone calls of people not being able to cope, with loved ones that are actually, using substances. Whether it could be alcohol, it could be, over-the-counter medication, prescription drugs, or it could also be just, your dacha, your nyaope, because a lot of people were experiencing some form of withdrawals. And people had to learn as family members, how do we assist? How do we get a loved one where we are locked inside the house to make sure that, they don't become violent, they don't actually, harm us or harm themselves. So we had to actually adjust, especially during level 4 and level 5. We had to, revert to a lot of Zoom meetings where self-help groups like AA and AA, we had to engage with them so that people can be able to access, still help in those areas. We've worked a lot of, with a lot of our centers. We've worked with the Department of Health as well as Social Development to establish a lot of shelters around the country, especially catering for those people who were living on the streets or people that were homeless, because some of them, as much as they were using, they were not able to actually go out. So they were actually more at risk. And so we had to offer a lot of detoxification kind of services with the help of Social Development as well as the Department of Health, where we established over 25 temporary shelters around the country. And through media releases, radio interviews and articles, we took advantage of that, to contribute in terms of the discussion around substance use disorder, what it does it include, how does it affect and impact families, and us as a society, as a country, we had to look at that. And most of our medical and therapeutic staff also had to receive, COVID-19 training and skills in order for them to be able to, to feel comfortable and be able to reassure the country that, they are complying and they know exactly what they need to do in terms of COVID-19 protocol. So that was a very interesting and a very good, way of us learning a new skill moving forward. Like now we are used to wearing masks and sanitizing as part of our day-to-day lifestyle. And that is something that we actually learned. And finally here, through services that had to be suspended for the whole period there, and most of our services have to resort to social media a lot. Not all our centers were able to operate during the pandemic or during the lockdown, the different stages. So when we got to stage 4, most of our rehab were then well ready and equipped to actually go through. So living with COVID-19 and way forward, we've learned that technology is the way to go. Fourth Industrial Revolution is here to stay, and if you didn't understand how to use Teams or Zoom, you had to learn quick and fast and learn new ways, of communicating with people around the world, around the globe, in a different way, the technology, than face-to-face. So it has really given us a platform to also grow and learn a new skill, if I could say. And mostly, obviously, part of our rural areas in our country were the areas that we really, really struggled to actually interact and really go into. And I think that some of the discussions even that we could really have, that how do we really stretch out our resources to those communities that really don't have much resources till today? How do we really make sure that help is out there and they know exactly where to go, what to do, and who to consult with? And that is something that we really look into. An increase of building, capacity building of staff, like counselors in public health services. It's been something that we've been doing, making sure that as much information about substance use disorder we share. We wrote articles as you visit our website, through our media, social media platforms. We engaged a lot in terms of educating people about substance use disorder, to also understand the terminology, and most importantly, to reduce the stigma. We still have people that are labeled as substance use disorder service users, whereby they call the Nyaope boys or whatever they might be called in the communities. Because you remember, again, when we're linking substance use disorder to GBV or mental health, we're also linking it to criminal activities that they can get into. So those are some of the things that we are really learning. And just to also focus at the root cause. Why, or what is the actual reason that leads people to start using? We've got various reasons of why people use, why people do what they do, and we will be addressing some of these gaps during our addiction conference that is coming up on the 21st to the 23rd of July this year, 2021. It will also be virtually. You are all more than welcome, and I would really encourage all of us in here, since we are working together in a holistic approach to get involved with it in our conference this coming July. And lastly, there with our anti-drug coalitions and the local drug action committees, we've established quite extensive ones around the country to make sure that we also get to hear the voices of our community members. What do they got to say? Let's involve the churches, the schools, just members, ordinary members of the community, young people who are also in the communities. What do they have to say? What kind, of help can they actually contribute towards the change and fighting the stigma of substance use disorder? So in terms of today, these are some of the overview of what we're going to be looking at. Firstly, we're going to be looking at the reasons of why people use and the impact on families. I'm going to talk about a bit of kick your habit. I'm also going to just give an introduction of substance use disorder so that you can be able to understand when we say it's no longer just substance abuse, but we need all of us to get used to the new terminology of calling it substance use disorder. What do we mean? The science of addiction, where it will get to explain exactly what it does to the brain. And I will look at the signs and the symptoms. And like I said earlier, Marika will be covering also the codependency of substance use disorder later on. And the access of clients of level of motivation, and how to refer clients to our suitable service providers, and initial assessment, and we're also linking it to other rehabs that are available in the country. And then lastly, to look at the workplace intervention and substance use disorder policy, especially in the workplace, in terms of what is our role as SANCA and how we contribute towards to that. So we can get different and various reasons why people use. I'm sure we've heard people talk about peer pressure. We've heard people talk about that there are no clear values and boundaries when it comes to families. We've got different structures of families. We've got people who come from different backgrounds. There's cultural also that plays a very huge role in terms of how, we look at people and why they really what leads them to actually using. So normally we also look at what kind of role models do we have till today in our country specifically. You as a parent, us as parents, what kind of role do we play till today? The world has grown so much today that sometimes monitoring and really just being there, it's actually at the bare minimum. Alienation, sometimes we've seen a lot of kids isolating themselves. We need to understand the reasons why they actually isolate themselves and what is actually the cause of that. We also look at the changes of family structures that actually takes place. Biogenetic predisposition, sometimes, yes, it does run in the family, but it does not necessarily mean just because my grandfather was an alcoholic, therefore automatically, the child will be an alcoholic. So there's a lot of contributing factors that plays into that. Lack of discipline as well. Remember, as I said again, it depends with the kind of different families that we are coming from. And that it also plays a role in consistent rules. Today, mom is like this, daddy say yes, mommy says no, bad cop, good cop, all those kind of things. Communication plays quite a critical role. And when we also look at SUD holistically, we also get to look at personality types. How is this person, emotionally doing? Emotional intelligence plays a very quite critical and important role when we assess behavioral and psychiatric problems, that the history of this particular person that might be coming through our doors, we need to make sure that the history is actually cleared out and we've got all relevant information. Any addictive personalities that we actually get to look at, that's why we work in a multidisciplinary team. In terms of our environment, I think this plays a very huge and a quite big role, whereby we look at social climate, subculture, surrounding those who are at risk. We're looking at lack of alternatives in our communities, like I said earlier. We're looking at lack of health recreation facilities, poverty contributing. We are not saying poverty is the reason people are using drugs. We're saying it's a contributing factor. All these are contributing factors that leads one to actually start using or abusing, substances. Unemployment, affluence, political instability in our country, moral degeneration, and chemical-oriented society. We're seeing how much drugs has actually grown in our country. It's actually quite scary. So here is the difference between a normal and a substance use disorder family, where we are talking about looking at open communication in most families. And I always say this again, that even if it's not in substance abuse families, it could be any other form of family that also does not have a good form of communication, that doesn't have support, all of these things. So here it's something that we've realized working through with families of our substance users in our facilities to see where's the gap and how can we assist these families to improve in poor communication in terms of lack of support, in terms of criticism, lack of respect, the being unreliable, unpredictable, loving and disciplined, feeling suppressed, distrust, unsafe, violent and abusiveness that takes place, conflicts that are avoided or handled badly. So these are some of the things that we've picked up from families when they bring in their loved ones. We've got cases whereby some people, when they come to rehabs, their families don't tell them that you're going to rehab. They'll tell you, well, you know what, we are going away for the weekend or we are going on a vacation and then boom, you are at our doorsteps. And remember again, the families, they've got their own reasons as well why they do that. Because some people, you've realized that, you know what, since they don't realize or see that they actually have a problem, what can I do to assist them? What can I do to help them so that, we are able to actually do that? So, and when we look at the normal kind of family, whereby all these, they need to play a critical role, including all of us sitting here. As I said, it's not just only about substance abuse families that sometimes, there are these kind of gaps, but all of us, let's look at all these normal kind of family values that we are actually encouraging our family members when they come through our doors on what to do, that being open, being honest, supporting the person instead of judging them, it's something that you guys need to look into. All right, Kick Your Habit, very good campaign. Mariki, actually, again, she's one of our centers that actually won part of our challenge of Kick Your Habit. So Kick Your Habit is a campaign that we run as SANCA on a yearly basis to educate the communities and the world on the issues and the effects of SUD. So what happens here is for the next 7 days, I would encourage all of us, even if it's maybe not 7 days, try 3 days. Choose something that you really cannot live without. What do you normally do every morning? As an example, if I could just hear maybe a few colleagues in the room, are those people that says, I can't live without coffee? Can I see one? Coffee every morning. Chocolates? Nothing. Yes, social media, your phones. Can you live without your phones? I doubt, So what we often do is we actually ask you to choose one thing that you can actually, abstain from that 7 days and actually see how you can change your habit. It can be chocolate, it could be meat, it could be cookies, because we're trying to teach and educate you in terms of what each and every person that walks through our clinic, what do they go through when we're saying they need to change. Because remember, recovery is a lifestyle. If I were to say to you from now on, you no longer allowed your phone for the rest of your life. You are no longer allowed to take your coffee for the rest of your life. How will that work? So we actually try to educate you. So there is a structured, program day to day. You can check it out on our website where it takes you that from day one, what do you need to do? Recognize and identify and become aware of your own feelings, your own emotions. If you didn't take your coffee today, do you end up becoming snappy or irritable? All those things. So we're trying to educate you with simple things that you yourself cannot live without. However, with that said, we do encourage everyone who has an alcohol or any substance use disorder problem not to actually just go through this Kick Your Habit challenge without consulting a doctor or consulting with us. Quite important, because we do understand that you can go through withdrawals, you can go through signs and symptoms that could be actually fatal for you. So it's quite important that you actually get to do that. So in terms of SUD, according to the World Drug Report that we received in June 2019, the United Nations on Drugs and Crime, the UNDC, have actually stated in their report that globally over 35 million are estimated to suffer from drug use, and about 1 out of 7 actually access treatment, which is quite scary in terms of their findings. And according to WHO as well, with their drug report and the Central Drug Authority, is that there's a picture of SUD in our country, which is quite scary if 1 out of 7 only is able to access treatment. Drug consumption in the country is twice as the world norm, which is quite scary. 15% of South Africa's population have a drug problem. And that was evident when we looked at, during the pandemic, what we've actually seen. And drug abuse is costing our country over 20 billion a year, and it could pose a bigger threat to the country's future than the AIDS, pandemic. And also with the stats that we got from SAPS, about over 60% of crimes nationally were related to obviously substance use disorder. And with the help of United Nations World Drug Report, it had named actually our country as the capitals of drugs in the world. I'm not sure where we are. Last time when I checked, we were number 9 in the world when it came to substance use disorder, and number 5 when it comes to fetal alcohol syndrome. That is where women who are actually pregnant, who are actually taking drugs or using alcohol. And that is something that we need to somehow, it's food for thought, that what can we do different. In terms of the signs of addiction, like I said earlier, this is not curable, it's treatable. And when we say it's a brain disease, it's because drugs do change the brain functioning of that particular person. We always explain this to young people to say that when you are young and your body and it's still developing, and you take drugs in your system, you actually, interrupt the full functioning of a body of a young person. And yet we sometimes get surprised when we see young kids can't concentrate on the long run, they have a cognitive impairment, they're not functioning well, they cannot think for themselves. When it comes to decision making, it's a problem. And then we wonder what went wrong. And this is one of the reasons that we are actually explaining that it does changes how the brain functions, because the changes that take place in the brain are long lasting, and they can lead to harmful behavior seen in terms of on people who actually use drugs. Whether it's nyaope, guys, is cocaine or heroin. I think also with dacha being legalized in our country, it has posed quite a huge amount of increase in terms of facilities where we've seen people that are abusing dacha than ever before. And that is something that is our reality. As much as it might be legal and good medically where it is proven, however, when it comes to substance use disorder, people smoking it, it is still quite a big problem in our country. And when we talk about the drugs in terms of how it affects in the brain, it affects the reward system in the brain, which is mainly responsible for reinforcing behaviors and creating memories. Each drug has a differential chemical structure that activates the reward system to create feelings of pleasure, that high. So I think Mariko will touch on that as well to say, when somebody starts using drugs, how it actually increases. Your body becomes dependent on this particular drug, and then on a long run, what it actually does, because you actually now require to take more dosage of that particular substance that you are using, because your body is tolerant to that particular drug. So it needs more. If you used to take 2, now you need 4. And then from 4, it increases and so forth. So that's basically what we actually see, because now they are chasing that particular high. So addiction, when we say it's a chronic disease, like other diseases such as heart diseases, due to the changes in the brain, and it's still there even after long-term absence. We still have people with long-term side effects and consequences of their drug addiction. For example, someone that, for example, with heroin as an example, I know this one person who actually struggled with sleep. They will only literally sleep 3 to 4 hours, that's it. Even after 13 years of staying clean and sober. So it depends, with the system. Like we always say when you go to the doctor, antibiotic that works for you doesn't mean it's going to work for me. So those are some of the things that we recognize and we take into cognizance when we are assisting, most of our clientele. It does disrupt the normal, the healthy functioning of the underlying organ and have serious harmful consequences that are preventable and treatable. But if left untreated, it can last a lifetime. We've lost a lot of people due to substance use disorder. Most of our patients that walk through our doors, they will tell you that. And we used to actually do what we call recovery evening, where we would light a candle in memory of each and every person that they know they've lost due to substance use disorder in terms of their memory, just to recognize, that this is actually a disease that can actually kill someone. And that's what we used to do. Relapse is part and parcel of actually recovery and our education because of the nature of the addiction. I'm sure you guys have come across people relapsing 5 times, 10 times, and people say, but this person has been going to rehab 10 times, 15 times. Why are they not getting it? You know, why are they not stopping? Why is it not changing? It's because the functioning of the brain has been interrupted, it has been damaged, and we need to take that into consideration. Hence, we are saying it's a disease and not just, it's a chronic illness that is a disease and not just somebody that they did them to themselves. Yes, it's a lot of discussion. We still have it till today. People saying it's a drug of your choice. You did this, you started experimenting, and then, you know, now we are saying it's a disease. We want everybody to jump in. But there's more thorough research that actually went through to get it there. And even before the DSM-5, it was part of the DSM-4. So it just took about, I think, 13 to 14 years before we can actually put it under DSM-5. And compared to other diseases such as your hypertension and sugar diabetes, it's what we link it to the kick your habit, because remember with people with hypertension or sugar diabetes, it took time or a while for them to say, you can no longer take sugar. Sometimes they relapse. Sometimes they crave. People with hypertension, you say, please eat less salt, but oh, that shisanyama is very good, tasty, and they want to eat it. So that's exactly how we explain substance use disorder, that you will experience cravings, and it's part of who we are. Sometimes if I crave chicken wings, I don't care whether they say, you know, it's fatty or whatever, I will go and get it. So imagine if somebody is craving something that they're not supposed to have for the rest of their lives. So what goes through their mind? And that is something that we need to actually look into. Paul, help me please. Does it move? Okay, thank you. The effect on the brain, as I said, it affects the three parts of the brain. The first part of the brain that we're going to look at is the cortex and the limbic system, as well as the brain stem. So all these parts of the brain, they work as a team to coordinate and actually, in terms of functioning, in terms of how we think, our breathing, how problem solving, how we think, how, you know, we do things, how we process things in our mind and our memories, that plays a critical role. So the brainstem, its main function is critical to life, such as our heart rate. That's why on a long run, people start developing heart problems, breathing, sleeping. Most of clientele that we've seen, on a long run, they can have asthma, you know, as well as heart problems, and they can actually have, like I mentioned, sleepless nights. It's something that is there most of the time. And when we're looking at the cerebral cortex, which is also the fourth part of the brain, which is the forebrain as well, that controls the specific function, which is the processing of all our senses, you know, what we see, how we feel, how we hear, how we taste, and then we're looking at also it empowers our ability to think, plan, solve problems, and make decisions. So most of the time when we're talking about SUD, this is the picture that you please need to understand. That when we're saying it is a chronic disease, it's a brain disease, this is what we mean. It affects how your brain functions in terms of how you think, how you process information, and how you actually, you know, be able to have the capacity and the ability to make decisions. That's why, as I said earlier, sometimes family members, you will see that sometimes they will do what we call involuntary, you know, admission, because we are realizing that this person really, they cannot help themselves. It's because now the functioning of the brain is really impaired and it really needs help. So that's why we keep saying that if you are saying to somebody, when are you going to go to rehab? And they say tomorrow, and tomorrow comes, they don't want to go. Understand that the three main functions of the brain, which is the brain stem, which is also a part of our limbic system, which talks about the pleasure that I was talking about earlier, in terms of the reward circuit, in terms of the cravings, that they want to actually chase this high. You know, it releases a lot of dopamine in that area, specifically in the middle of the brain. And then when you're looking at the forebrain, where it is responsible for problem solving, they cannot solve the problem on their own. That's why we've got what we have these days in terms of voluntary and involuntary to assist people. All right, so when we're linking a substance use disorder, we do link it to co-occurring disorders, where meaning that we are linking substance use disorder with a mental disorder or with a medical disorder. Like I said, mental disorder, it can be your bipolar or any depression, and then, for example, medically, it could be, you know, your heart problems, you've got sugar diabetes, you've got HIV, because it does also link to HIV. Most of our clientele as well, instead of sniffing, instead of smoking, they're actually injecting also. So that's why we also get to link it with HIV. So this is just to give an indication that about 45% of those with SUD have at least one of mental disorder, you know, and that is our reality. That's exactly what is happening. So when we're treating somebody with SUD, we don't just look at the drug issue. That's why, you know, our medical team do a thorough, holistic approach of assessment of and screening to make sure that what is actually our priority. For example, if somebody has a medical, issue, we would really recommend that can they get that, for example, with HIV, how can we make sure that this person is treated for HIV as much as we're going to be working with them with substance use disorder? How can we control their sugar levels, their BP, so that they can be able to actually get help, you know, in terms of SUD? And then looking at some of the signs and symptoms, holistically, when we're looking at physical changes of a person with SUD, you look at their appearance, depending on the kind of drug they are taking. Most of our Nyaupe users, they will tell you or inform you that the reason they don't want to bath and they stay the way they are, it's because they don't want the drug to come out of their body or their system. So they feel that if they don't bath, the longer they are not bathing, the longer it stays. And that's where they are at. And sometimes that's where we need to meet our clients. We meet our clients where they are at. You'll see when we also discuss the stages, you know, of change, which we encourage a lot of us to actually familiarize ourselves, especially in the professional work that we do when we are working with SUD, so that you can be able to assess the person and the stages of change from the beginning and even during treatment and after treatment, so that you can be able to make sure or know exactly where they are at. Because sometimes somebody can say, I'm ready to go to rehab. When they get there, when they come out, the next day they've relapsed. And we wonder why. So stages of change will definitely help us. We're also looking at personality change. This changes consistently, where the inconsistency of a person takes place, you know, not meeting deadlines, things like that, or a person saying, I will do this, and they don't do it. They don't actually live up to their promises or to their word. They experience a lot of mood swings. They're extremely unreliable, untrustworthy, and that's the personality that you might recognize or observe when you're working with people with SUD. Behavioral changes, secretive behaviors. You don't know where they're going, or how, or what's happening in their lives. There's a new set of change of friends around them, and the places now they are beginning to go to, their goals have changed, their dreams have changed, and most of the time, borrowing money from colleagues, friends, and family is a no. You know, I'll bring it back, please borrow me, you know, tomorrow I'll sort you out. Work and school performance, we see it by inability to keep deadlines, kids not doing their homework, coming late to school, absenteeism also in the workplace, especially on Mondays, especially also on Fridays as well, excuses, unlawful purchases, you know, they buy things, you know, on the black market, things like that, manufacture, distribution, possession, as well as sell or store or use illegal drugs while on duty. We've seen that a lot to make extra money, because it's quite expensive to actually, you know, maintain, you know, your drug addiction. It's actually quite expensive. Disciplinary actions, always this person is at disciplinary actions. There's written warnings, there's warnings, and fraud and theft cases, police looking for this person, people looking for person, random people, you know, looking for your loved one, and you're like, who is that? That person looks like, you know what, they're not okay, but what is it? So those are some of the things. And disappearing during work, it's like, I'm coming back, I'm going to the loo, 1 hour, 2 hour, the person is still not back from work. Family problems that we've come across, domestic violence, conflict in the families, people going through the divorce, affairs, infidelities, financial problems, big issue, societal problems as well, that includes increasing crime, family violence, child neglect, unemployment, as well as sex work, HIV, and other diseases. We've seen that a lot taking place. So these are some of the physical symptoms, just to pinpoint them, like, for example, sweating and unexplained bruises, deterioration in appearance and personal hygiene, tremors, you know, people shaking, diarrhea, vomiting, abdominal pains and muscle cramps, restlessness, irritability, frequent use of breath mints, gum, or mouthwash, odor of alcohol on breath. These are some of the things that we recognize. Just to be careful also sometimes with the odor of breath is that a lot of people that also have sugar diabetes, to be careful. We always say, you need to be careful. Just because somebody's smelling of alcohol doesn't necessarily mean it's alcohol. So do a thorough history of the person's health as well to actually understand that. These were the stages that I was telling you about in terms of how to assess someone, to make sure that, to know where they are at. As I said, somebody can come to rehab and say, I am at, the preparation state, I'm ready. But when we do the assessment, we realize that actually this person was given an ultimatum. It's either you go, or if you don't go, this is what's going to happen to you. So they actually were at stage 2, but yet they said to you they're at stage 3. So that's why sometimes our program is also not just custom made. We encourage our therapists, our holistic multidisciplinary to always work together. What do you see? Because we all see things differently as professionals. So that's why we work together. So it's very important and critical that these stages play a critical role. Before treatment, during treatment, and after. After meaning after care. Because during treatment, we also get to look at, is this person saying, are they ready to actually go on? Are they at the action stage? Are they at the maintenance stage? When they talk about their recovery, how are you going to stay clean? You've been using for 20 years. You can't just stay clean and by just saying, you know what, I've learned a lot from the clinic and I understand what addiction is, but what are the physical changes? What kind of attitude, behavior are you changing? How are you replacing old habits with new habits that are healthy, that are good for you? Because recovery is a lifestyle. And these are some of the things that we need to look into. And this is actually helping us a lot to actually recognize that this person that is about to live outside these doors tomorrow, they actually still at pre-contemplation. They're not sure how they're going to deal with the friends out there when they say to him or her, let's go use. They're not sure how they're going to deal with the stigma and the prejudice of the community when they come back. And these are some of the things that will help us to determine how to assist them moving forward. So as our role as professionals, we normally do a lot of motivation by looking at their determined goals, looking at positive attitude they actually have as well towards their recovery, because it's a lifestyle. Leave personal problems aside when we're looking at assisting somebody with SUD. How do we upgrade our knowledge as professionals and skills to make sure that we can still give good quality of service to our clientele? Be passionate about substance use disorder. If you're not passionate, you're impatient, you will not make it in our field. You need more than that. I always say you need godly patience in order for you to be in this field. You need to decrease or eliminate energy drains, practice self-talk. Remember also as professionals, we can't help all of our clientele, and that's our reality. So we wish and pray that, if I've seen 5 or 10 people, they can all stay clean forever, but the reality is it does not happen that way. So we don't take it personal or feel sorry for ourselves to say, oh my goodness, what did I do wrong? I did everything but the book. I even went extra, So that's why we say this comes with a passion. Confront challenges and fears, meditation, as well as acknowledge and reward success. Principles of effective substance use. Addiction, very important, it's not curable but rather treatable. Addiction is seen as a progressive and a chronic disease. No single treatment is appropriate for every individual, like I mentioned. Treatment must be readily available. Treatment addresses multiple needs of the person and not only the addiction, like I said earlier. Ongoing assessment throughout to make changes to the treatment plan of the client. This is where the stages of change come through as well. Length of treatment and attending aftercare is quite critical for us. And combination of intervention approaches from eclectic, holistic, and integrated approaches when we are doing it. When it comes to our SANCA structures, this is our treatment program that we have. Inpatient treatment, outpatient treatment facilities, early intervention prevention, the way it takes place, and community development, public education, and training. So even when you do your assessment, you're about to refer a client to our treatment centers, we always say you need to establish whether this person needs outpatient or inpatient. It depends with the history of the person in terms of how long they've been using, and maybe if, for example, somebody would say, I've stayed clean for 30 days, and when you really test them, they are clean, and then we can look into an outpatient program. And with that also said, people are different, and that's why I say you need a holistic approach in terms of treating and looking into the approach of whether outpatient or inpatient.
Your time, madam.
Thank you. Oh, all right, let me
just conclude.
All right. Yes, this is in terms of alcohol and drug workplace, when we do a written policy, we always use the cornerstone of a drug-free workplace, and at a minimum, the policy should include rationale, example, laws, regulation, and organizational goals, expectations for compliance in terms of you need to work with your HR in the company, who does what, when does that need to take place, when and where, options offered for assistance like EAP, community services, and consequences for violating the policy process. So these are some of the services that we are offering, and this you can read through in terms of the slides, in terms of what actually goes through in terms of the drug policy when we are assisting companies that we are actually working with. So in conclusion, we all have our own addictions, and this knowledge will make us more understanding, tolerant, and less judgments to the people that are actually using drugs. Addiction is a disease that is treatable but not curable. People will have different reasons for why they use drugs, and their reasons and their own signs and symptoms depending on the type of drug they're actually using, the quantity consumed, and the stage of addiction that they are currently in. The workplace experience and increase of substance abuses affecting work dynamics, profit, and working relationships. Therefore, it's the perfect starting point to tackle these issues, especially in the workplace. And lastly, there is hope, for people with substance abuse problems, and you and I can do something about it. Ladies and gentlemen, thank you.
Thank you so much.